me.
Good afternoon. I'm Susan. I'll be performing an assessment on you today, doing hand hygiene. Can you tell me your name and birth date, please?
Matt Evans, 7684.
Good. I'm going to be inspecting your hearing today and taking a look at your ears. Do you have any concerns right now?
Not currently, no.
Let me shut the door and give us some privacy. Okay, I'm going to ask you a few questions first about your hearing and about your ears in general. Have you had any recent changes in your hearing?
No.
And do you feel like you've had any excessive drainage, any excessive wax buildup? Have you noticed any changes in that
No.
part of your ears? Any pain in or around your ears?
Sometimes they ring. Sometimes I have a painful ringing.
Have you been diagnosed with tinnitus?
I have.
Has that gotten worse or lessened any recently?
It's maybe a little worse, if anything.
Okay. Have you noticed any roaring or cracking in your ears?
No.
Have you had any ear infections, any head trauma, ear trauma, or earaches?
Ear trauma. Long ago.
Okay. And what happened then?
Eardrums were burst.
Okay. Any family history of hearing loss?
No.
Do you work or live around loud noises where you would need to wear hearing protection?
Yes.
Do you wear hearing protection when you're around loud noises?
I do.
Okay. And when was your last hearing exam?
Roughly, maybe 13, 14 months ago.
Okay. And how do you care for your ears on a daily basis?
Wash them with a washcloth, and on the outsides of them, I'll hit it with a Q-tip.
Okay. Very good. I am going to inspect your ears. I'm going to be feeling on them, and then I'm going to take a look inside of them with the
Okay.
otoscope. Okay? Do you have any questions for me before I start the exam?
No.
Noticing that his ears are even to his eyes. They're appropriately spaced. Their soft skin is appropriate for ethnicity. Flows well with skin tone on his face. They are warm to touch, dry. I don't see any dirt or excessive oil. They measure about 7 centimeters on the right. No lesions, areas of broken skin. About 7 on the left as well. Earlobes hang freely. Small bit of hair externally. Any pain or tenderness when I'm touching your ear?
No.
How about back here?
No.
Mastoid process seems firm. No issues there. Alright. I'm going to take a look inside your ear. My otoscope here. Let me know if you have any pain when I'm doing this. Just pull gently up on the back side of your ear. Tympanic membrane is gray. No discoloration. Light concave from the otoscope is at 5 o'clock on this right side. Do the same thing over here. Left ear is the same. Concave light reflection is at 7 o'clock. Very good. I'm just going to use my light to look in here a little bit more. Skin looks very good. We're now going to do a whisper test. I'm going to have you cover, let's start by covering your left ear. And I'm going to say a few 2-syllable words behind you, and you need to let me know if you can hear them and then repeat the word.
Okay.
Okay? I'm going to get behind you. Put your finger right here on this portion of your ear that's called your tragus. Okay.
Football. Popcorn. Flashlight.
Good. Okay. let's swap and we'll do the other ear. Okay.
Baby. Doorknob. Basket.
Very good. 3 out of 3 on both ears. Did very well. Now I have a tuning fork here that I'm going to use. I'm going to strike it. I'm going to place it on the top of your head. This is called the Weber test. And you just let me know if you hear it more on one ear or less than the other.
I think I hear it equally in both ears.
Equally in both ears?
Yeah.
Let's do it one more time.
Equally in both ears.
Good. Okay. Next is the Rhine test. I'm going to use the tuning fork. I'm going to place it right back here behind your ear. I want you to tell me when you quit hearing it. Then I'll place it right here next to your ear and tell me if you hear it again.
Okay. Okay. Yeah, I hear it.
Okay, good. Do that on the other side.
Okay.
Hear it? Good. Very good. One more test and we're all done. We're going to do the Romberg test. I need you to stand. Very good. Just stand still. Now, kind of fix your eyes in a position on the wall. Good. Now close your eyes. Very good. You can have a seat. Patient was able to hear the tuning fork equally on both sides when the Weber test was performed. The Rhine test also, patient was able to hear the tuning fork and minimal swaying with the Romberg test. Thank you very much, Mr. Evans, for your time.
Thank you.